I'm Dr. Matt Brengman. I'm going to talk to you a little bit about gastric balloon therapy as a targeted therapy for weight loss. The balloon is a device. It goes inside the stomach. It's placed either in the office or at endoscopy. It takes up space, right? So think about eating a big meal, only a month later it's still there. The balloon is incredibly well tolerated. It's been well studied around the world. About 250,000 balloons have been placed over the last 12 years or so, and very, very few complications associated with it. The balloon is good for about 15% weight loss and when it works well. So for the patient that has a BMI of 50, maybe it's not quite enough to get them to a BMI of 40, but for the person that has a BMI of 46, 47, it's right in the zone to get them to a BMI of 40. The balloon works in two ways. So obviously it takes up space. The balloon is about the size of a softball. It occupies about half of the space that's in your stomach if it was completely full. Now, we don't really use all the space in our stomach all the time. So of the effective space we use, probably 80% of our effective space. It makes it so when you eat a small measured meal of about 4 ounces, the patient feels very comfortable with what they've eaten and controls their hunger. The balloon has a secondary effect. It really alters gastric emptying, so the food you eat hangs around a little bit longer, also controlling your hunger for a longer period of time. The balloon is placed and it stays in for 6 months. People lose weight for the first 3 months. So we think of people losing all the weight they're going to lose over the first 3 months. They're seeing the doctor and the dietitian on a regular basis. The second 3 months the balloon is in place, I like to think of it as consolidating their weight loss. It's still working. It's keeping the weight down, allowing the patient to make the changes around diet and behavior with that tool, helping them keep their hunger controlled. So they have 6 whole months to kind of change their relationship with food, what they eat, how they buy their food, when do they eat, how do they go to work and eat, how do they travel and eat, all these things. At 6 months, the balloon is removed. So that mechanical effect goes away. And one of 3 things is going to happen. The patient's going to keep all the weight off. For that person, the behavioral modification's been enough, their weight's stabilized, and they're able to keep their weight down. Most people are getting a little bit of weight back. They're able to eat a little more, and it just takes a little bit of time to get a handle on the behavior overcoming the mechanical effect. So maybe they gain a few pounds, but then they keep most of the weight off. And then there's people that have the mechanical effect goes away, the balloon comes out, and they gain weight rapidly. That mechanical effect was so important to their weight loss and their hunger control that they really need that in order to keep their weight down. All those outcomes are good outcomes, right? So obviously somebody keeps the weight off where they want it to be, that's a great outcome. Even gaining a little weight back, that's really still a good outcome. Now you might say, but if I gain the weight back, how could that possibly be good? Well, the weight coming back's not so great, but understanding that a mechanical intervention can lead to significant weight loss and keep it off is important for that patient, because we have other interventions that are permanent, that are safe, that can lead to then dramatic and permanent weight loss. And so finding that out, that's an important thing to find out. And so the balloon's really an effective therapy for most people, and it provides a lot of great information. It's well tolerated.